introduction about the immune system. And I may know that you take the immune system in microbiology lectures, and you may have an idea about the immune system. And then we will discuss the disorders of the immune system, which is the objective of our course. In these 3 lectures, we are going to study the diseases or the problems of this immune system. And the first disorder of the immune system that we will cover today is the hypersensitivity reactions. And we will know what is the definition of hypersensitivity reactions and what are the types of hypersensitivity reactions, which include mainly 4 types, and we will discuss them in this lecture, inshallah. So, at first, what is the immune system? The immune system is the protection from infectious pathogens. So, this system is designed to protect our body from any foreigners to our body. For example, infectious agents, foreign materials, malignant tumors, anything that is foreign to our body, we have an immune system that protects our body from them. And this protection is mainly done by 2 mechanisms. The first mechanism is by the natural immunity or the innate immunity, okay? And the second mechanism is done by the adaptive immune system, okay? Or we call it acquired or specific immunity. So what is the innate or natural immunity? It refers to the mechanisms that are ready to react to the infections even before they occur. And the innate immunity is the first line of defense, and it will induce a rapid protective host reaction. So the natural immune system or the innate immune system, it is already present even before infection, and it is always ready to protect our body, and at the same time their action is rapid, and at the same time their action is non-specific, okay? So they are fighting against everything, okay? And this natural immune system at first includes epithelial barriers. So our skin, our mucosa, our epithelial tissues, our endothelium of blood vessels, all the epithelial tissues that are present in our body, that are covering our body, like the skin, or underlying our tissues like the GI or the respiratory system. All these epithelial tissues are barriers. They are physical barriers that protect our body against infection. Also, we have certain phagocytic cells that you know them in inflammation, which are the neutrophils and macrophages. These cells are present in the connective tissues in small amounts, and they are always ready to fight and react against the pathogens. Also, we have certain type of lymphocytes. We call it natural killer cells. And these natural killer cells, from their name, they are killing every time and everywhere, and they are ready to kill the infections or the foreigners. Okay. Also, we have dendritic cells. And these dendritic cells, we call them antigen-presenting cells. So these cells, from their name, they are presenting the foreigners or presenting the antigens to the immune system, so the immune system can react to them. In addition to these things, we have also proteins in the plasma that include complement system, C-reactive proteins, the lung surfactant, also regarded as part of the natural immune system because it gives protection against the inhaled microbes. أعتقد الصوت واضح والصورة واضحة. ممكن تكتبوا لي حتى نكمل. نعم. Okay. إذا in this diagram, you can see we have an antigen-presenting cells, and these antigen-presenting cells, they capture the antigen, okay? And this antigen will go by these antigen-presenting cells to the lymph node station, and in the lymph node, this antigen will be presented to our immune system, mainly to the helper T lymphocytes. And these helper T lymphocytes will release chemical mediators that activate our immune system. So, antigen-presenting cells, it is a type of dendritic cell that represent the antigen to the T lymphocytes in our body. Okay, The adaptive immunity, it develops later and after exposure to the microbes and other foreign substances. It is more powerful, it is more specific than the innate immunity in combating the infection. So in this diagram we can see this is the natural immunity, epithelial barriers, some cells, antigen-presenting cells, phagocytic cells, natural killer cells, complements. They are the first line of defense. They react rapidly, but their reaction is usually not very strong, and it is also not specific because they react against everything. Then the adaptive or the acquired immune system, they will react specifically, more powerful, and it will try to eliminate the pathogens, okay? And the adaptive immune system, as we will see, it includes mainly two types, either humoral immunity or cellular immunity, okay? Humoral immunity, we mean by the name humoral that the main players in this type of reaction are the antibodies, okay? And these antibodies are released from plasma cells, and these plasma cells coming from the differentiation of B lymphocytes. So these antibodies will be released against the antigens, and it will try to eliminate them. At the same time, we have another type of acquired immune system, which is the cellular immunity. And the cellular immunity is usually, the main player in it are the cells, which are the T lymphocytes. And these T lymphocytes will stimulated by the antigen-presenting cells, and then it will proliferate and give rise to effector cells that are trying to kill the microbes. Okay, so the adaptive immunity, as I said, it is either cellular, okay, or cell-mediated immunity, which is mediated by T lymphocytes. Why we call them T? Because they are derived from the thymus, okay, and it is responsible for defense against intracellular microbes such as bacteria, viruses, tumor cells, and parasites. While humoral immunity, it is mediated by B lymphocytes, and these we call them B because they are derived from the bone marrow, and these B lymphocytes will secrete antibodies, which we call them immunoglobulins, and of course after differentiation into plasma cells, and this immunoglobulin will protect against extracellular microbes such as extracellular bacteria or extracellular toxins. In this diagram, we can see this is the antigen-presenting cells, and these antigen-presenting cells will react with helper T lymphocyte, which we call them CD4 positive T lymphocyte, or if they will react with cytotoxic T lymphocyte, we call them CD8 positive T lymphocyte, and the CD4 positive, which are the helper T lymphocyte, will give rise to cytokines that will help, from their name. Why we call them helper? Because they help other immune system cells to react against the pathogens. While the CD8 positive T lymphocytes, we call them cytotoxic T lymphocytes. Why we call them cytotoxic? Because these cells are fighting other foreigners and they kill them directly, so they will call them cytotoxic T lymphocytes. I didn't give many details about these type of cells because I suggest that you take them in either in microbiology lectures or in the video that I send it to you, so you can see what are the subdivisions of these type of cells. Now we come to the immunoglobulins, which are the antibodies secreted from plasma cells that came from differentiation of B lymphocytes. And these immunoglobulins, chemically, it is composed of two heavy chains and two light chains. So they are composed of 4 chains, 2 light chains and 2 heavy chains, and these chains usually have an antigen binding site here, okay, which we call it the variable region of the antibody, and here we call it the constant region of the antibody. Here the antigen will react with the antibody, and here the immune system cells will react with the antibody. So this is portion of the antibody, we call them the FC portion of the antibody, while this portion of the antibody we call them Fab region of the antibody. Also we have complement binding sites that may activate or react with the antibodies, and also we have certain disulfide bonds that join these chains together. So this is the general structure of immunoglobulins, and these immunoglobulins are usually composed or include 5 types, and these 5 types are either IgG, RGA, IgM, IgE, IgD. So IgG means immunoglobulin G, IgA, immunoglobulin A, and so on. So what we mean by IgG? The IgG, it is the most abundant type of immunoglobulins, and it is present in the plasma and the tissue fluid and this type of immunoglobulin can react or can cross the placenta. So the IgG was the most common type of immunoglobulin, and this type can cross the placenta in case of pregnancy, for example. In IgA, it is the next most common type of immunoglobulin, which is present in the plasma and in the saliva and intestinal secretion, and it has a protective mechanism in the mucosa of the GI system. So the IgA was the next most common type of immunoglobulin, and this type of immunoglobulin not only present in the blood or the plasma, it is also present in the saliva, in the intestinal secretion. So it is not only present in the blood, but it is also present in our secretions like the saliva or the intestinal secretions. And so it has a protective mechanism in the mucosa of the GI system. So this type of immunoglobulin can react with the pathogens even in the lumen of the GI system before their absorption. Now the IgM, it is the largest immunoglobulin. It has the largest molecular weight of immunoglobulin, and it is found only in the plasma. And it is the first immunoglobulin which appear after antigenic stimulation of the B lymphocyte. Okay, so the IgM was the largest in size. Okay, and it is only present in the plasma, and it is the first type that occurs or that appear in the blood after the antigenic stimulation of B lymphocyte. Okay, so when our body exposed in the first time to any pathogen, the first immunoglobulin that occurs or that will be formed in our body is the IgM immunoglobulin. Okay, and after that, after repeated exposure, there will be appearance of IgG. Okay, and all of you now hear about the test of COVID-19. We can make an antibody test, and we all usually make IgM and IgG against COVID-19. So IgM indicates recent infection, while the IgG indicates remote infection. Okay, so these type of immunoglobulins that occur after antigenic stimulation. IgE, it is also present in the serum and in the surface of the mast cells and basophils. It is involved in the protection against parasites, and it may mediate the allergic reaction. So the IgE, it is another type of immunoglobulin that is reacting with the mast cells and basophils, and it is involved in the protection against parasitic infestation. Okay, the IgE, and the IgE also have a role in the allergic reaction, especially in type 1 hypersensitivity reaction that we will discuss soon, inshallah. IgD, it is also present in the serum and in the surface of the B cell. So these are the types of immunoglobulins that we have. All this is introduction about immune system. I may suggest that you take them or have already have an idea about them. So now we come to our lecture and our objectives of our 3 lectures in immunopathology. And these objectives are the diseases or the problems or the disorders of the immune system. And these disorders include either hypersensitivity reaction or transplant rejection, autoimmune diseases, immune deficiency syndromes, and amyloidosis. All these types of diseases, they are related to problems in our immune system, as we will see in our lectures. Okay, the first type of disorders of the immune system are the hypersensitivity reactions. So what we mean by hypersensitivity reactions? Immune responses that are normally protective are also capable of causing tissue injury. So, as I said, the immune system or the immune response usually created to protect our body. Okay, this immune response, if it is excessive or abnormal response, it will be injurious to our body. So it will cause a problem to our body because we have excessive or inappropriate response. Okay. So the injurious or excessive immune reaction are grouped under hypersensitivity reaction. So what we mean by hypersensitivity reaction? From its name, hyper, it means excessive or inappropriate response against the antigens. Okay, and the resulting disease here, we call it hypersensitivity diseases. Okay. On the basis of the immunological mechanism which mediate the disease, hypersensitivity reactions are classified into 4 types. So these hypersensitivity reactions usually have 4 types according to their mechanism, which include type 1, type 2, type 3, type 4. And these types, they are named specifically to each type of reaction. They are like the cranial nerves. When we take the 7th, when we say the 7th, we call the facial nerve. The 5th is the trigeminal nerve. This type of reaction also, when we say type 1, it means the immediate hypersensitivity reaction. When we say Type 2, it is the antibody-mediated hypersensitivity reaction. When we say type 3, it is an immune complex-mediated reaction. And when we say type 4, we mean cell-mediated or delayed type hypersensitivity reaction. So we will come to them and discuss them each one separately. The first type, which is called type 1 or immediate hypersensitivity reaction, it is a rapidly developing immunological reaction occurring within minutes after the combination of an antigen to an IgE antibody bound to the mast cells in individuals previously sensitized to that antigen. Okay, so the type 1 reaction, it is a rapid reaction occurring within minutes after combination of the antigen to an IgE antibody. Okay, and these antibodies will be bounded to the mast cells in the individuals previously exposed or sensitized to that antigen. These reactions, we call them allergy, and the antigen that cause these reactions, we call it allergen, as we will see in this diagram. So in this type of reaction, the body will be exposed to a certain substance like pollen or like certain type of diet or like certain type of anything in the weather or anything that is foreign to our body. We call it allergen. Okay, this allergen usually doesn't cause any problem in normal people, but it causes a problem in patients or in people having a hypersensitivity reaction against them because of a defect or disorder in the immune system. Okay, because of imbalance between the effector and the regulator cells of the immune system, so we will have a reaction against them. So this type of antigen will cause problem only in individuals which are predisposed to the type 1 hypersensitivity reaction. This allergen will come to our immune system. It will stimulate the T helper lymphocytes, and these T helper lymphocytes will secrete cytokines that will stimulate the B lymphocyte. The B lymphocyte will differentiate into plasma cells, and these plasma cells are able to secrete immunoglobulins. In this type of reaction, the type of immunoglobulins produced by plasma cells are the IgE immunoglobulin. This type of IgE immunoglobulin, it is secreted and released in order to combat this antigen. It is released in order to eliminate this antigen. But at the same time, these immunoglobulins can react with the mast cells. Okay, they will attach to certain receptors in the mast cells, and after attachment to the mast cells, there will be activation of the mast cells, and on repeated exposure to the mast cells, there will be release of mediators from the mast cells. The mast cells are unique type of cells that are present in the connective tissue of our body, and as you see, the cytoplasm of the mast cells is filled with vesicles. Okay, they are filled with granules or filled with vesicles. All these vesicles contain chemical mediators. They are already synthesized. They are already present inside vesicles, so they are ready just to be released according to the signal that is done by the IgE immunoglobulin. So these mediators will be released. Okay, and as you see here, this is the mast cell, and these are the IgE, and this is the antigen. Okay, on exposure to that IgE and antigen, there will be degranulation, release of already formed granules. Okay, in addition to that, there will be certain mediators that came from membrane phospholipids. Okay, so we have certain mediators that is also released from the membrane phospholipid of the mast cell, and these granules and the membrane phospholipid mediators, they are responsible for the immediate response that occur in type 1 hypersensitivity reaction. And this immediate response includes vasodilatation, vascular leak, and smooth muscle spasm. The granules usually contain histamine, protease, chemotactic factors that you already discussed them in inflammation, chemotactic factors, and membrane phospholipids that include arachidonic acid and TAF, which include prostaglandin D and leukotrienes B4, C4, and D4. And I think that you will take them in pharmacology or already take them in inflammation lectures. Okay, membrane phospholipids. At the same time, there are other type of molecules that are released from the mast cells, and these molecules will be synthesized after exposure. So they will take time until they are released. They are synthesized by the rough endoplasmic reticulum, okay? And these molecules will cause a late phase reaction. Cytokines that will be secreted later will cause a late phase reaction, and this late phase reaction will include leukocyte infiltration, epithelial damage, and bronchospasm. Okay, so this is the pathogenesis of type 1 hypersensitivity reaction. So as we said, the mediators that are important in type 1 hypersensitivity reaction include, first of all, vasoactive amines, which are released from the stores inside the granules, okay, and they cause the immediate reaction. The granules of the mast cell usually contain histamine, and the histamine it is the most important chemical mediator released from the mast cell. It causes vasodilatation, increased vascular permeability, smooth muscle contraction, and increased secretion of mucus. And all of you may take at certain time may take alarmine, okay, drug alarmine اللي هو drug taken when people having allergy, for example, or having itching or having some sort of allergy. The alarmine, it is usually antihistamine, okay. It is a substance that is act against histamine, okay. So the alarmine, it represents a type of drug that deactivates the substance histamine, which causes the allergy. Also, we have chemotactic factor release for neutrophils and eosinophils, and by the way, the eosinophils are the most abundant type of cells that come in type 1 hypersensitivity reaction because of the chemotactic factor that activate them. And also we have neutral protease such as tryptase enzyme and acetic proteoglycans like heparin and chondroitin sulfate molecules. All these are vasoactive amines that are released from the granules of the mast cell. We have also newly synthesized lipid mediators, and the mast cells can synthesize and secrete prostaglandins and leukotrienes by the same pathway as other leukocytes, okay? And the prostaglandin 2 will cause bronchospasm as well as increased mucus secretion, while leukotrienes C4 and D4 are several thousand times more active than histamine in increasing vascular permeability and also causing smooth muscle contraction. Leukotriene B4 is chemotactic factor for the neutrophil, eosinophil, and monocyte, as you know. Okay. The third type of mediator that will cause the late phase reaction. They are the cytokines. The activation of the mast cell will result in synthesis and secretion of several cytokines that are important for the late phase reaction. And from these cytokines include TNF, chemokines, interleukin 4, and interleukin 5. So the clinical manifestation of type 1 hypersensitivity reaction, yani what are the clinical features that we may see in a patient having type 1 hypersensitivity reaction? It is either a systemic reaction or localized. يعني ما يكون reaction all over the body, or it is localized to a certain part of our body. The systemic reaction are usually called anaphylactic shock. Okay, you already take the shock in hemodynamic disorder, and you know that the shock, it is either hypovolemic, cardiogenic, neurogenic, or septic shock, or anaphylactic. So the anaphylactic, it means due to systemic type 1 hypersensitivity reaction. For example, after bivenum exposure or after penicillin, when it is administered to allergic patients, they will cause systemic anaphylaxis. So one of the most important things that we should take in patient history is the drug allergy. We have to ask the patient about the drug allergy. If you have allergy to penicillin or allergy to any other drug, because this allergy can activate type 1 hypersensitivity reaction and cause anaphylactic shock. Some people also after exposure to يعني لدغة العقرب أو لدغة الأفعى ممكن أيضا يصير عندهم type 1 hypersensitivity reaction. And this reaction could be also localized or local reaction. And this depends on the portal of entry of antigen. It may cause only cutaneous swelling like skin allergy, or nasal and conjunctival discharge like allergic rhinitis and conjunctivitis. It may cause bronchial asthma, okay, and also it may evoke allergic gastroenteritis, food allergy, especially in pediatric patients. They may have allergy from milk or allergy from bread and so on. Because inflammation is the major component of the late phase reaction in type 1 hypersensitivity, its control usually requires anti-inflammatory drug like steroids. So the steroid is a very important drug that can be used in type 1 hypersensitivity reaction, especially in anaphylactic shock or sometimes even in bronchial asthma. We can give a steroid because the steroid will act as anti-inflammatory agent, and the inflammation is the major component in type 1 hypersensitivity reaction. In this slide, you can see this is a nasal polyp, and this nasal polyp is infiltrated by chronic inflammatory cells. There is plasma cells here, we have lymphocytes there, and also we have abundant eosinophil. As you can see, these are cells with eosinophilic cytoplasm. These represent the eosinophil, and this eosinophil, they are very abundant in allergic or type 1 hypersensitivity reaction. Why they are abundant? Because the mediators that are released from the mast cells, it includes chemotactic agents that will stimulate the recruitment of inflammatory cells, especially eosinophil in large amounts. So when you see eosinophil, you may think about allergy, or you may think also about parasitic infestation. These two disorders, they will activate the eosinophil. Okay, and this is an example about an allergic nasal polyp, and here we have inflammation in the nasal mucosa, and this inflammation, it is triggered not by infection, but it is triggered by an allergy against some substance that is only causing reaction in some people, while other people will not have a reaction against it. So this reaction or this type 1 hypersensitivity disorder, it is due to the inappropriate or excessive immune response against this allergen. Okay, so it is a default in our immune system rather than caused by infection. Also in bronchial asthma, in asthmatic patients, and we will discuss them inshallah in the respiratory system. The asthma is two types, either atopic or non-atopic asthma. The atopic asthma, it is usually characterized by a type 1 hypersensitivity reaction. There will be abundant eosinophil, mucus secretion, and congestion. And you can see here there are the bronchi. This is the cartilage of the bronchus, and here we have congestion of the blood vessels, and here we have inflammatory cell infiltration, and here we have abundant mucus secretion in the bronchi. Okay, and by higher power you can see that most of the inflammatory cells are eosinophil. Okay, and also we have congestion of the blood vessels that are present in the wall of the bronchi. Okay, so as you know, the bronchial asthma is characterized by excessive bronchospasm. There is excessive contraction of the bronchi, which is triggered by type 1 hypersensitivity reaction. This is all about type 1 hypersensitivity reaction. Now we will move to the type 2 hypersensitivity reaction. The definition of type 2 hypersensitivity reaction, it is an antibody dependent type. So the main player in type 2 hypersensitivity reaction are the antibodies. Okay, and which antibodies that play a role in type 2 hypersensitivity reaction? It is either IgG or IgM. There is no role of IgE in type 2 hypersensitivity reaction. IgE only is triggering type 1 hypersensitivity reaction, while IgM or IgG, it can trigger type 2 hypersensitivity reaction. This reaction is mediated by antibodies directed against antigens that are fixed on the surface of the cells or in the tissue components. يعني a type 2 hypersensitivity reaction, the cause of this reaction are antibodies. Okay, and these antibodies will react against certain antigens, and these antigens are present either on certain cells or they are present in some tissues or tissue components. Okay, the clinical example of this reaction is a transfusion reaction. All of you know that there are blood groups, which we call them ABO blood group, and also we have the RH system in our body. Okay, so when we give blood from patient from person to person with incompatible blood transfusion for the ABO blood group, for example, person having A positive blood, give a blood to another person who is B positive, for example, okay, or A positive to A negative, and so on. So when we have incompatibility in the blood transfusion, okay, the RBC from the incompatible donor will enter the recipient circulation, okay. يعني RBC of the donor راح تدخل إلى recipient, okay, and they will become coated with the antibody directed against the RBC antigen. Why? Because the people which are B blood group, when they receive blood group A, the blood group A having B antigen, okay, and the blood group B, they have B antibody. So it will act as an antigen-antibody reaction, okay. This antibody will coat the RBC of the donor, okay, and they will result in lysis of the RBC of the donor. So the patient will end with hemolysis of the blood that he received, and this hemolysis may trigger a shock and result in hypovolemic shock and may result in death. So it is very important before doing blood transfusion to make an ABO and RH compatibility, and this is done by taking a drop of blood from the donor and a drop of blood from the recipient, and we mix them in a slide and wait for a time and to see if there is a reaction between them or not. If there is no reaction, it can be given safely. If there is reaction and hemolysis, so you have to change the donor, okay. Also, in Graves' disease, there are antibodies directed against the thyroid-stimulating hormone receptors, and these antibodies will stimulate the thyroid epithelial cells, and it will result in hyperthyroidism, and we will see in the next slide. Also, we have myasthenia gravis, pernicious anemia, and acute rheumatic fever. All these disorders are triggered by type 2 hypersensitivity reaction, as you will see. Now, in type 2 hypersensitivity reaction, as I said, it is an antibody-dependent type. يعني the main player in type 2 hypersensitivity reaction are the antibody. And these antibody, how it will cause the reaction? The mechanism by which these antibody cause the reaction by 3 or 4 ways. The first way, these antibody can cause opsonization, okay? And you know what is opsonization. Opsonization, as I said to you, opsonization that the body cannot recognize the foreigner, okay? The antibody will go to the foreigner and coat it, okay? And after coating of this foreigner, the immune system then can recognize this foreigner, okay? So after opsonization of virus, certain virus or bacteria or even some normal cells are opsonized, after opsonization by the antibody, there will be phagocytosis and death of this tissue by the phagocytic cells. So this process of opsonization is triggered by the antibody. So the antibody here will cause this type of reaction because it will trigger the process of opsonization. And by the way, the process of opsonization here, it will not be against a virus or bacteria or pathogen. It is usually against a normal cell or normal tissue. So we call them type 2 hypersensitivity reaction, or we call them hypersensitivity reaction because it is an inappropriate reaction, okay? Because it is an abnormal reaction in our system against ourselves. So this is the first mechanism. The second mechanism, these antibodies may cause complement activation, and it may trigger inflammation, as the usual way of stimulation of inflammation that you take in the inflammation lecture, that these antibodies can trigger the activation of the complement system, and they also activate the inflammatory cells and release the neutrophils that cause death of the tissue. But in this reaction, the reaction is against our body, our cells, rather than against our against pathogens or against foreigners, okay? The third mechanism by which these antibodies can cause type 2 hypersensitivity reaction is by antibody-mediated cellular dysfunction. And what we mean by antibody-mediated cellular dysfunction? We mean by that these antibodies can either block certain receptors or can either activate certain receptors. How? All of you know that the neuromuscular junction in which the nerve gives impulse to the muscle in order to contract is done usually by the presence of acetylcholine. And these acetylcholine will trigger the receptors that are present in the neuromuscular junction in order to give rise to contraction of the muscle. If we have antibodies, these antibodies that block the gates, they will block the receptors, they will inhibit the process of activation of these receptors. These antibodies will prevent acetylcholine from reaching the receptors. So these antibodies will cause antibody-mediated cellular dysfunction. It is cause dysfunction of this mechanism, okay? It will inhibit the process of neurotransmitters to the receptor, so the muscle will not contract. And this is what is done, or what occurs in myasthenia gravis. In the disease, which is, we call it myasthenia gravis, it is characterized by muscular weakness. يعني المريض عنده ضعف العضلات أو ضعف في تقلص العضلات، وهذا الضعف نتيجة عدم كفاية أو عدم قابلية الأسيتالكولين أن تصل إلى الريسبتورز. وهاي ليش ما تصل إلى الريسبتورز؟ بسبب وجود هذه الأنتيبوديز اللي هنسميها inhibitory antibodies against the acetylcholine receptor. The opposite occurs in Graves' disease. In Graves' disease, this is a thyroid cells, okay? And these thyroid cells release T3 and T4 in response to TSH hormone, okay? The TSH hormone coming from the pituitary, okay? If we have an antibodies against the TSH receptor, but these antibodies will stimulate the receptor rather than inhibiting it, so the thyroid cells will be continuously stimulated, okay, by abnormal antibodies against the TSH receptors. And this continuous stimulation will result in continuous elevation of thyroid hormones, T3 and T4, and this will result in stimulation of the receptors without TSH hormone. يعني pituitary in this case are not releasing TSH hormone, but the autoantibodies against the TSH receptors who take the function of the TSH and continuously activating the cells of the thyroid, and this will result in elevation of the thyroid hormone. And this is what occurs in Graves' disease. Also, all of these are mechanisms by which type 2 hypersensitivity occurs. يعني الانتيبودي هذا يا اما يسوي لي اوبسونايزيشن الى normal tissue او normal cell، وبالتالي يحفز الفاجوسايتوزيس، وبالتالي يحفز الديث of this type of cell، او هذا الانتيبودي راح يحفز الكومبلمنتس ويحفز الميديترز مال الانفلاميشن، لكن هذا الانفلاميشن ما راح يكون ضد فورينرز، بينما راح يكون ضد اور بادي في الاوتوميون ديزيز، وهذا ايضا راح يسبب لنا مشاكل نتيجه inappropriate response. او هذا الانتيبودي راح يقفل ريسبتورات معينة أو راح يحفز ريسبتورات معينة، فبالتالي يؤدي أيضا إلى خلل في عمل هذه الريسبتورات، وبالتالي أيضا راح يؤدي إلى ديزيز. كل هذه المشاكل حدثت بسبب أنتيبودي، أوكي؟ وهذا الأنتيبودي قد يكون IgG or IgM type. Okay, you can see here the RBC of the donors. If it is given to people with ABO or Rh compatibility, these RBC will be coated by immunoglobulin. This is IgG or IgM, and this immunoglobulin coating the RBC, it will make opsonization of this RBC, and it will be engulfed by the phagocytic cells, which are the neutrophils in this example. Okay. Now, in type 3 hypersensitivity reaction, in this case, the main player are the immune complex, okay? And what we mean by immune complex? Immune complex, it is the antigen-antibody complex. And in this case, it differs from type 2. In type 2, the main player is the antibody. يعني الانتيبودي بالتايب 2 هو اللي يسبب لنا المشاكل ويسبب لنا الرياكشن. بينما بالتايب 3 مو فقط الانتيبودي اللي يسبب المشاكل، وانما الاميون كومبلكس اللي تكون بين الانتيبودي وبين الانتيجين هو اللي ادى الى المشاكل وادى الى الديسيز اللي صار بالتايب 3 hyper sensitivity reaction. It is mediated by deposition of antigen antibody complexes, and this deposition will trigger complement activation, and the activation of the complement will trigger the process of inflammation, and it will result in accumulation of neutrophils, which we call them polymorph nuclear leukocytes. So you can see here are the B lymphocytes that will differentiate into plasma cells. The plasma cells will release antibodies, and these antibodies will react with the antigens, and it will result in the immune complex formation. This immune complex will be deposited in the tissue, here the blood vessel, okay? And this deposition in the wall of the blood vessel will trigger inflammation in the wall of the blood vessel, that we call it vasculitis, and it will trigger the inflammatory cells to attack the wall of the blood vessel, okay? And the type 3 hypersensitivity reaction, it is either systemic reaction, يعني in all over the body, or it is a localized reaction. And examples of this type, and as you will discuss inshallah, is the disease which called it SLE, systemic lupus erythematosus, and post-streptococcal glomerulonephritis. Both of them, it is triggered by type 3 hypersensitivity reaction. The usual consequence of this immune complex deposition, يعني immune complex هذا أما يصير في deposition in the wall of blood vessels ويؤدي إلى vasculitis, oh, it will be deposited in the basement membrane of the glomeruli and it will result in glomerulonephritis. and إن شاء الله في الفصل الثاني راح تاخذون محاضرات النفرولوجي مع دكتور مصطفى, and he will discuss with you the types of glomerulonephritis, and most of them it is triggered by the deposits of immune complex. يعني هنا هذا اللون الأخضر يمثل لي deposit of immune complex اللي هو عبارة عن antigen antibody rather than only antigen or only antibody. Here we have a immune complex composed of antigen and antibody. It will trigger the neutrophils to attack the glomeruli here, or sometimes this immune complex can even accumulate in the joints or in other tissues. Okay, here in this slide you take them in محاضرات cell injury. There will fibrinoid necrosis in the wall of a blood vessel. This pinkish area, it is a fibrinoid necrosis in the wall of a blood vessel, and the deposition of the immune complex in here we call it vasculitis. Then, and this vasculitis inshallah أيضا راح تاخذوها في محاضرات vascular pathology. Most of the cases of vasculitis it is an immune mediated يعني cause. يعني cause of vasculitis in most conditions it is an immune mediated by type 3 hypersensitivity reaction, and also we have another type of vasculitis which is caused by infections, but most of them it is an immune mediated reactions which include immune complex deposition in the wall of the blood vessels and triggering of inflammation and then necrosis, which is usually of fibrinoid type. So this is an example of type 3 hypersensitivity reaction. Now we come to the last type of hypersensitivity reaction that we call it type 4 hypersensitivity reaction. In this type, the main players are the cells, so we call it cell mediated reaction. And here we don't have any antibody. لا عندنا ال IgE اللي شفناه بالتايب 1, ولا عندنا ال IgG وال IgM اللي شفناه بالتايب 2, ولا عندنا الاميون كومبلكس اللي هو ايضا يتضمن الاي جي ام والاي جي جي مع الانتيجينز بالتايب 3. هنا ما عندنا اي انتي بودي, عندنا just we have lymphocytes which are sensitized T lymphocytes. Okay, the main player in type 4 are the T lymphocytes, and these T lymphocytes are divided into two types. We have two types of T lymphocytes. يا اما عندنا يعني او العفو التايب 4 hypersensitivity reaction راح يكون عندنا نوعين, يا اما يكون عندنا delayed type hypersensitivity reaction او عندنا direct cell cytotoxicity. These are two subtypes of type 4 hypersensitivity reaction. يعني type 4 hypersensitivity reaction يا اما يكون على شكل delayed type reaction, and this type of reaction usually mediated by the helper T lymphocytes which are the CD4 positive T helper T lymphocytes, or the type 4 hypersensitivity reaction it is يعني appears as a direct cell cytotoxicity which is usually triggered by the cytotoxic T lymphocyte which is the CD8 positive T lymphocyte. Examples of this type of reaction include rheumatoid arthritis, multiple sclerosis اللي هو التصلب اللويحي او تصلب الاعصاب المنتشر, التايب 1 diabetes mellitus يعني النوع الاول من السكري, الانفلاماتوري باول ديزيز اللي تشمل الكرون ديزيز والالتراتيف كولايتس. كل هذه diseases are examples of these type 4 hypersensitivity reaction. In this type of reaction, okay, the antigen presented by the antigen presenting cells will result in activation of the helper T lymphocyte, and that will secrete cytokines that activate macrophages to form epithelioid cells and granuloma. So like the usual mechanism of a granuloma formation, there is an antigen presenting cell to the helper T lymphocyte that will release mediators activating the monocyte to come to cause inflammation, and it will become very active. We call it epithelioid cells. Some of them will make aggregation. It will appear like giant cells, and this epithelial cells are covered by lymphocytes and fibroblasts, so it will result in a granuloma. But the difference here between this granuloma and the granuloma that you take in inflammatory or inflammation lectures, in inflammation lectures, the granuloma develop against infection, like tuberculosis or like leprosy. Okay, it occurs against infection. Here, the granuloma that occurs in type 4 hypersensitivity reaction, it occurs against our tissue or our cells. Okay, it may result in Crohn's disease. So in Crohn's disease, also we see granuloma. But what is the cause of granuloma in Crohn's disease? It is an immune granuloma. It is a disorder of the immune system that results in a granuloma. Okay, and so on. So it is an appropriate response. Yani here, the antigen, it is usually not foreigner antigen. It is part of our body or part of our tissue or a part of our cells that the immune system have an appropriate reaction against it. So we call it hypersensitivity reaction. By this, I come to the end of my lecture, and this is the reference of my lecture. And I hope that the things going well, and if there is any question or comment, I'm ready to answer you.